Hi, this is Dr. Sanders with Zeal Integrated Health. Today I'll be going over stretches for frozen shoulder. Now if you haven't seen our video that we did on frozen shoulder, be sure to check that out right here. Now I want you to keep in mind before I get in these stretches that this does not replace treatment for frozen shoulder, okay? You need treatment by a qualified professional. These are just to help that treatment progress more smoothly, okay? So I sat in this area here so we could utilize things that are around us all day at home. These are to be done throughout the day. The first stretch that I like to give patients is very simple. Keep in mind, people with frozen shoulder do not have very much mobility in that shoulder at all. So these little movements are big deals. First, we start with our hand on the table. This is called finger walking. And you can do it horizontally, so on a table just like this. And as you go out, you do it to resistance. When you start to feel that shoulder hurt, you hold there and try to let that relax, okay? And you can back up and do it again. And you can do this all throughout the day while you're sitting. Also, if you want to add a little more to this, you can take and slide back in your chair and lean forward and really stretch that shoulder out. Okay. Now the other part of this finger walking is on the wall or a doorway. So we're going to stand up here. We're going to utilize this wall, and what we want to do is kind of walk our fingers up this wall. Same thing, slowly using those fingers to pull our shoulder up. The whole purpose of this is not using these muscles through the shoulder so they stay relaxed, but that we get the mobility through it. You may not be able to go very high, but you want to keep in mind that the more you do it, the more height you'll be able to achieve. The next thing we want to go over is called the pendulum stretch. That's exactly how it sounds. Leaning on a chair, you can lean forward and just let that arm hang down. Now this affected arm, you just want to swing small circles just like that. You'll notice some restrictions, but as you start to get more mobility through there, your circles can get bigger and bigger. Now if you need to, you can always add a lightweight 2 to 3 pounds. This is like a can of vegetables or something like that you have in your pantry. And that weight can help distract that shoulder and move it around as well. Another object we like to use that everyone has lying around at home is a towel. This towel can be utilized in 2 ways. We'll be pretending that this shoulder is the one affected. Now the first one is the over the shoulder stretch. So that can come down here. You grab that towel with the affected arm, and then you use the good arm to pull that back. Now I'm going to turn around so you can see this. As I pull this way, I'm able to get that arm stretched back here. And you can pull until it gets stretched and then work on pulling it up. Now if over the shoulder is too difficult, you can always just do around the waist. So you take the towel here on this side and pull just across this way. Okay. The last stretch that we'll do is just cross body, and sometimes this is very difficult, especially for those who can't get their affected arm up. We'll go back to the right arm being affected, but all this is a crossover and a pull towards. As people start, they may only be able to do it down here, but as we loosen it up, we'll be able to move it higher and higher. All right, these can be done in any order and to your comfort. The big point I want to make here is that you are consistent with them and you do about 10 to 12 repetitions per day throughout the day. This is a slow stretch, okay? This isn't a pull it fast and hold. This is let it ease into it. Frozen shoulders or adhesive capsulitis is something that can last up to 3 years, but doing this daily with treatment from a qualified professional can leave those shoulders a lot healthier and more mobile. Thank you.